basically the tools matter less than the brain and the intentional thinking behind it.
Yeah.
So you have to help people understand you have to understand what folks' roles are in the organization and build solutions that sort of work with what.
Hi, Andrew. Thank you so much for doing this. We really appreciate you taking our time. So, before we talk about our children surgery centers, I think a great starting point will be if we talk a little bit about your own professional journey. I was looking at your profile, and you have quite impressive experience in operations, project management, IT, and right now you're working as CIO. So, if you talk a little bit about your own professional journey and where you are right now, I think it would be a great starting point.
Thank you, and thank you for the kind words. Um, yes, my professional journey, I think, started when I was in second grade and I was typing my papers up on an old IBM PC with the old green screen and the clickety clack. And so, in truth, my affinity for technology actually started a long time ago. But yes, um, I've spent all of my career working in various different either technology or operational type of roles. And then about 5 years ago, I switched from Silicon Valley based uh, and Silicon Slopes based companies to healthcare.
Right.
And I am really enjoying what I am doing. Yes, I am. My current role is CIO for children's surgery centers. So yeah, that's what I do.
Thank you so much. So, how does your day-to-day responsibilities look like right now at Children's Surgery Center? I know you folks have multiple branches or multiple locations. So, how does your typical day look like? What kind of challenges you are dealing with on daily basis in terms of your job responsibilities?
So I manage all of our technology, whether that's tools that we are using internally for our HQ type of folks and our clinical type of folks, but also all of the patient-facing tools that we have as well. So I think some of the challenges that I see just generally across healthcare is this notion of interoperability.
Mm.
A lot of companies make products and they think that they're solving one key thing, and a lot of times they are solving one use case, but they don't think about how to get all of these tools to work together. So that is probably the biggest face. That's the biggest challenge facing, I think, healthcare technology is all of the stuff that we people like me have to do in order to get these things to work together.
Yeah, and believe me, I understand. I hear you what you are saying, because based on my experience, and especially when you work with very diverse ecosystem, and in healthcare, like there are typically legacy platforms as well. They are maybe built on a very old technology that don't exist right now,
Hmm.
and then there is a huge, large number of systems that are purely on the latest stack. So if you have to integrate both, it is very difficult to find universal layer that will work for all of them. So I understand the challenge you are saying, and I think it's not only just the integration challenge. It also comes with another variety of challenges as well. For example, data security, making sure that
Yes.
integrity and privacy of data is being maintained through this process. So if I have to ask you the kind of tools you are using right now in children's surgery centers, are there any EMRs? Are there any other tools that you are using, and how well connected they are with one another and the other ecosystem that is out there?
Yeah, I think of any I think of any healthcare space really as that. Yes, there's around workflows, right? There's this notion of scheduling. There is the notion of of communicating with patients. There also is data, and then and what I mean by data is putting the data into a framework that not only allows you to continue to bring in different sources of data, but also to report on that data. And so, yes, there's EMRs. There's lots of those. our surgery centers do a little bit different work. We do dental procedures
Right.
in our surgery centers. And so we actually have a dental EMR in the on the dental side of healthcare. They're actually referred to as practice management systems, or PMS is the actual term that we use. But yeah, we have a dental PMS today. And then kind of what you're talking about too. We also have those, that's more that the clinical side. And then yeah, we are using um, um, cybersecurity. We're using identity and access management. We're using multi-factor authentication to protect. I typically have used Microsoft products, the Microsoft Stack for that identity and access management, multi-factor authentication, and just word processing type of tools. Today we're on G Suite, which is fine. It's a good tool. But basically, the tools matter less than the brain and the intentional thinking behind it.
Yeah.
So you have to help people understand you have to understand what folks' roles are in the organization and build solutions that sort of work with what they do.
Yeah, absolutely right. I think you're absolutely right in saying that it's more of a mindset issue in healthcare when it comes to connecting and the approaches and the processes. So I want to ask you, Andrew, from your experience, because I think there are probably more than 200 EMRs that are out there in at least in US market, and there are big names as well. So was in my understanding, not every EMR is best suited for dental practices. The one
Mhm.
that you are using right now, is it something that that you adopted, or is something that you also have some sort of customizations done from your perspective to best suit the workflow you have in your surgery centers?
Yeah, it's a fair question. Yes, and there are a lot of EMRs. There are and they run the gamut of different specialties. And so I think that the answer to your question is yes and. So yes, there are times and places where there is required a customization, whether that's for the RCM and billing side of it, the scheduling side of it, the patient communication side of it. There's also there's tools there. I think though at the end of the day, you really do need to understand the workflow of the practice or of the clinic or of the hospital, or you do need to have somebody sort of sit down with the people that are actually doing the work on the front line,
Right.
and you need to understand what their challenges are. And then you select tools and make them and build the connective tissue between them, whether that's in somebody in-house or whether you go outsource that. There's always build versus buy decisions. But um, the best thing to do is to understand how they do their job. I think that we, as leaders, do your entire business a disservice when you top-down mandate a set of tools simply for the purpose of cost reduction. So, and thinking that you're scaling, you have a lot of failed rollouts that are
Right.
from a top-down perspective. You have not invested in people who know technology if you invest in just accountants making decisions, you will fail if you're just driving things out from the accounting
Right.
side.
Got it.
And
Absolutely.
that I'm sorry, I'm actually not sorry. I'm saying that at all. I've been around too many companies that were just pushing things from the accounting side or the finance side and not including anybody with any technical acumen, and all of those projects fail.
Yeah.
All of them do.
You are right, and especially with what I am noticing with AI coming in many and many areas of what we do. I do see that a lot of founders or CEOs, they are just looking at AI from cost reduction point of view, and they are bringing in tools and AI chatbots and other things in place. But what they should really consider is what their workforce is, how they are looking at these AI tools, especially a
Hmm.
lot of clinicians we talk to. They are very careful about adopting AI purely from the perspective of they are not sure about data security, they are not sure about the confidentiality of their patients when they are talking to them, and AI bot or AI module is recording the conversation and doing some
Hmm.
inference on that. So I understand what you're
Hmm.
saying is that I think there is a big percentage of leadership that is making decisions purely from financial lens, and they are not taking into consideration the opinion and perspective of their workforce, and more importantly, the clinicians. I think this is important that there should be a balance of both. Yes, the technology adoption should be there, but I think if clinicians and healthcare workforce is comfortable enough for that,
Hmm.
I think it can create a good balance and create a win-win situation.
Yeah, we live in a margin versus mission industry. The clinicians have taken an oath to do no harm. All of them have.
Right.
Um, Businesses are in business to be in business, right? I understand that. But people do need to understand that there is that cognitive dissonance in the healthcare industry. It is a margin versus mission business. People need to start from there and really understand that it is, you have to live that in both those worlds. In terms of the AI side, I think also, if you, again, I'll go back to having a technology mind in this conversation that needs to be at the table. There are significant risks to AI.
Right.
Number one, you download, you're down, you go to your chat GPT and you ask it, just ask chat GPT, are you HIPAA compliant? And chat GPT will tell you that it is not HIPAA compliant.
Right.
Okay. That's thing number one. Thing number two is if you are a business executive and you're downloading any one of these tools and it's a freeware version, you are by definition mixing owned and unowned data by definition.
Right.
So you are now sharing if you are an executive and you download public chat GPT and you start using it, you run the risk of sharing your material information for your company with the public chat GPT. And when you squeeze that toothpaste out of the tube, it never comes back.
Right.
So if you're an executive and you're doing stuff like that, uh, yeah, we're going to see a lot of litigation. We are going to see a lot of litigation. Um, AI is moving very quickly, and it is a very powerful tool. It makes good people better. It does not
Yeah.
replace
Humans.
people.
Yeah.
I will repeat that.
Mhm.
AI does not replace people.
Right.
It makes good people
Mhm.
better.
Right.
So, what I do as a technologist, as I lead with a very strong hand in far as this goes, and I protect our the business, I protect our business, and I protect our patients. It's one and the same thing to me. And I don't care who you are as a CEO.
Yeah.
If I find that ChatGPT private version or the public version is on your computer, I will take your computer away and take that off of your machine.
Right.
I'm sorry, not sorry.
Yeah.
So that notion of mixing owned and unowned data, plus then you also have the you run the issue then where you are creating tools that are now not supported.
Right.
You're creating connective tissue. And if I were to replace an EMR, for example, replace an imaging solution, replace a patient communication solution, who is going to go back and fix that code, that little applet that you have made that you just thought was so good for everyone? And now, 6 months on, it broke.
Yeah.
Who's fixing it? Just out of curiosity.
Yeah. Yeah. You're right. Someone had to show me a demo of an AI tool, and they were from cybersecurity domain, and they said that their product is AI enabled product, and what it does it will scan your GitHub repositories. Uh, you to scan your code, and it will identify anything that is not written correctly, and it will automatically fix that, patch that piece of code with their own replacement. So when
Yeah.
so just yeah, it may fix one thing today, but let's just imagine that if we have to go back and troubleshoot and in
Hmm.
future anything is reported on compliance side or if there is any data leak because of that, I think no one will have capacity to understand that piece of code,
Correct.
go and fix that. So all these,
And that Uber really smart executive with hippo priority, right? That came in that day and had that brilliant idea. That guy or girl may not even be at the company anymore,
anymore, yeah,
right? So, yeah, as technology leaders, we have a fiduciary responsibility to be very measured and intentional
right,
how we deploy
mm,
AI tools in healthcare,
right,
yes, but also in fintech,
right, yeah,
right?
yeah,
In cyber,
yeah,
yes, right? Any place where there is PHI or PII must be measured and deliberate. It is not. You go into the Wild West and, you know, that's a challenge. But does that mean that we don't take time and set aside resources and have an AI framework and actually go after it? No, we must.
mm,
We must go after it.
right.
But let's not be disingenuous at all about really what this is and what it can do. Let's not be disingenuous at all.
Right, understood. So I want to ask you about the same line. Do you believe that it will make sense for organizations to have an internal AI work group, the work group that should really
Hmm.
understand AI and that should really understand its repercussions, and that group should make wise decisions based on their own research whether something should be adopted or something should not be adopted inside that organization. Will it make sense for companies to have that, and basically this work group can comprise of technical folks and subject matter experts as well, and based on their collective research and wisdom, decisions should be made within organization about going ahead with adopting any tool or process or not.
Yeah, I think any sort of adoption of AI and building that framework is a holistic thing, right? You are doing it with your CISO. You are doing it with your compliance people. You are doing it with your IT team. And you do have the best people to do this with also is the department for which this product is going to be used. So if it is for an accounting tool, for something in finance or in P&L gathering or accounts payable sort of work, then you should be including those people, right? So yes, there does need to be a centralized AI committee, and they need to be following your AI policy that has been driven by your AI framework that smart people have deployed. And then you go and you have your pilots
Yeah.
with the individual tools, with tools that are designed to do specific things, and then the kind of tools that are AI where they're not necessarily giving you, like an email enhancer or something like that. What they're doing is they're like giving you the Legos, the Lincoln Logs. They're giving you like the tools to create your own.
Mm.
That's fine.
Right.
That's fine. But they must follow, you still, it's still business. You still have success criteria for these things,
Right.
right? Before you invest full scale into something like this, right? But you are deliberate, you are intentional, and you do have to go after it. Yes.
Yep. So Andrew, how does your cloud landscape right now look like? I think you briefly mentioned about Microsoft Azure, if I'm not wrong.
That's right.
So are you purely on Azure, or you're also utilizing some services of AWS or Google or other cloud providers?
So we are shifting a little bit. We're in a foundational shift a little bit for some of the tools that we're using. Um, I think and that's just me right now. Me in my previous experiences, we had made a shift to Azure as our and leveraging Fabric. Um, we to me though, it's not solidifying necessarily in one cloud, private or otherwise. I still deal with the fact that I have, the accountant saying, well, you got to live in your budget too. So when you have budget driven decisions and business driven decisions, it just takes a little bit more thinking, a little bit more time, and a little bit more planning. and better negotiation skills, to be perfectly honest. Um, One of the things that you do as a technologist is, and if you get in any sort of leadership, is you have to be able to, you have to stare down somebody and say, no, 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 we're not going to go with that. That's an expensive 5-year deal. No, no. I view this as you make shorter term deals. You also get really detailed on your technology and your security risk assessments before you deploy any of these tools. And so, yeah, again, I'm not opposed to on-prem or cloud. I'm not opposed to any of that. I've lived in both of those spaces long enough to know that not any one of those is the right answer. Again, understand the needs of the business. Understand also too, from a cybersecurity perspective, if I have a multi-site location and if I have those sites all connected, then if somebody opens an email and it deposits something in one facility, then boom, I have to assume that it's all at all of the other facilities too. So I also think that when you have a cybersecurity mindset in this space, you do think about segmenting your businesses off from one another. Your facilities, you don't connect them. They are not interconnected. That's so that you can isolate um, a facility if the bug gets in on one of those facilities. So I actually do think about I think about cyber from a holistic perspective too, and this notion of all of the attack surfaces. And so, yeah, that's my approach.
Understood. I think it's a wise approach to segment your infrastructure in a way that something gets compromised, the radius should be limited and to maybe one center or something. So I want to linger on a little bit on that and wants to know your advice. It purely makes sense. I think from cybersecurity perspective to have different subnets, different network, different segmentations for each center probably to manage it well.
Hmm.
But from administrative point of view, are you using any centralized control? For example, is there any centralized Active Directory, or is there any centralized identity and access management in plan? For example, if you have to roll out one security fix to all the centers, what are you using for accomplishing that?
So like I said, we're moving from G Suite to Microsoft. We're going to be doing Office 365 in the cloud. Uh, I use the DLP within Microsoft. I use multi-factor authentication policies. This is just all by group policies. Looking at deploying Intune as well to lock the machines down
Right.
so that people don't implement. So yeah, I've gotten in all in on, and then enterprise applications, again also by group policy objects. So patching, yeah, so if a machine comes online and we give it a name, then it knows to go out and do its do its round of patching, and the policies are then applied, and then the person then can use the machine. So it's not rocket science. There are lots of tools out there too from a RMM perspective. Ninja is a good tool.
Yeah.
The Sophos and the Sophos stack and the Ubiquity stack, those are good ones as well. Yeah, there's a few of them out there. Again, at the end of the day, it really is somebody also saying to themselves, yes, well, these are the things that are needed. Let's go get these tools, do these work together. And can I get data out of it? So interoperability, usability, data, and cost. That's my, that at the end of the day, that is the four metrics that I use. And I have achieved success in that as well.
Sounds great.
So,
Thank you. So what you will recommend to someone who is starting to implement cybersecurity in the organization, and just like yourself, they have multiple centers. What do you recommend to put in place for proactive monitoring, especially around performance and security, just to make sure that if anything is about to happen, there should be some alerting or some notifications in place for those.
yeah, go get the right people first,
Right.
and then those people bring with them their tools. I mean, CrowdStrike is out there, Sentinel-1 is out there, Symantec, Norton Antivirus is out there. There's a lot of them out there that understand how to protect an endpoint, but you can't just do the one thing. You can't do endpoint protection and not do patching. Okay, you can't do if you're doing patching and endpoint protection, but you're not doing like cybersecurity training for your people to help them spot the bad kind of emails and understand that, hey, this is kind of weird on this phone. I'm not sure why you're asking me to go out and no, I've got the forms here. No, no, no. Why don't you come out and click on this link? No, wait a minute. We don't do that. Okay. So being able to spot um, how the guys come in, there isn't, and also just understanding there isn't any one, there's no iron dome that's going to protect against everything. There is not. And if any cybersecurity company is telling you that they give you 100% guarantee, that is not your partner. Do not, you just hang up the phone on them and move on to the next. Because the reality of it is, there isn't any one thing that is going to always protect you in every situation. So yeah, that's something you have to be really clear with, um, right from the get-go. So go get the right brains, go get the right people, and those people go get the right tools.
Right.
Give them a budget. Give us a budget. We'll figure it out.
Right. So I really liked your approach or idea that people are always going to be probably one of the weak link in the security chain.
Hmm.
So how do you make sure? I am sure there must be a lot of new staff coming on board in the organization. How do you make sure? I understand there might be routine security awareness trainings going on, but is there an extensive onboarding security specific process you have in place too?
Whenever I talk to an IT vendor or an MSP, or when I'm reviewing an MSSP, somebody that is going to provide an outsourced SOC. It's called a Security Operations Center, a SOC, right? Um, Whenever I am interviewing these people, that's a fair question. How are you helping? What are you doing to help the people not click on the emails, not take the wrong phone calls, not go to those websites that you shouldn't go to, right? How are you doing that? And the answers come back in all different shapes and sizes, honestly. I literally had one MSP, old guy. I think the last time he picked up I think, he got his MCP back in like 2001. Okay. And he said, "Oh, people don't fall for those kinds of emails anymore." And no, I just could not believe that guy said that out of his mouth because it's just not true.
Right,
The real issue is mindset.
right,
You have got to be aware. And so one of the things that a good CISO, good CIO, anybody who's in charge, whoever's in charge of cyber protection, you must go out and make good relationships with people, whether that's you individually or through your team or whatever. We have to know what they are seeing. So teach them how to right click and report as spam or right click and delete and block or whatever it is. Please let us know. Please be communicative. Let us know, because sometimes they'll see the one thing, but they don't realize that across the organization and across that everybody is seeing this.
mm,
And so if everybody's seeing it, whoa, there's things that we can do.
understood.
There are actions that we can take.
Yeah, and
Um, just be communicative with us if as you see things. There's also you okay, so you misidentified something. Great. I'd rather have you tell me. I'd rather have it be what we call a false positive than to just not tell me or just not report it. So yeah, just if you see something here, it's just like any sort of OSHA or compliance or anything. If you see something, say something.
right,
That's okay. Nobody's getting in trouble.
right,
Just if you see something, say something. So having that, yeah, and that's the other thing too is if somebody's reporting something, you say thank you.
right.
You say thank you if somebody's reporting. It's just really simple. Be a good person in any organization.
And I think organization need to reward attitude more than
Mm-hmm.
outcomes because of course
Mm-hmm.
people have this fear that if they go and tell them that they did something dumb, they might get punished for that. But I think, this approach should be a little bit different. And
Mm-hmm.
on the same side, I want to get your perspective of what you feel about having a good whistleblower policy in terms of cybersecurity inside the organization. are you supportive of that mindset that there should be a whistleblower policy where, for example, someone notices someone else, their coworker, someone sitting next to them doing something which was not aligned with company's security policies, anything like that?
Yeah, I think you bleed. There's this bleeding. There's things where IT blends into compliance, and then by the same token, there's things where IT blends into HR.
Right.
Right. So having good, being a good corporate citizen from a leadership of an IT perspective literally means that we are friends with the HR department.
Correct.
We are friends with the compliance department. We, as IT, we are friends with everybody
Hmm.
in an organization, operations, accounting, finance, HR, sales. Just be part of the corporate be a good corporate steward, be a good corporate citizen, and then do what you say you're going to do so that they can trust you.
Got it. I think we just consumed our full half an hour. It was great conversation. I really love talking to you, and I feel there are a lot of areas we can talk more. But I really appreciate you taking our time and giving your insights and wisdom. I'm sure it's going to be useful to many of our listeners.
Okay, great. Well, thank you very much for the time.
Thank you, and
Glad to help.
have a great day.
See you later.
Bye bye.
Yeah, see you. Bye.